started with the X39 around June when you introduced it to me. I had already had my nutraceutical line that I was repping. And I guess the best way to explain it, I felt pretty darn good until age 70 hit me. And then all of a sudden, I'm starting to get all these diagnoses. The first one that came through was PMR, which is polymyalgia rheumatica, which is an inflammation of the muscles and joints. It's like a precursor to arthritis under that autoimmune category. And the only thing that mainstream medicine had to offer me was prednisone. That's the drug of choice for PMR. Off at 15 milligrams of prednisone. And of course, you don't want to be on that very long. And it took off, the edge and so forth. But then when you introduced me to the patch, of course, after stem cell, I sort of knew it. I knew what it was. And I was trying to figure out what this little patch that I'm wearing right here is going to do for me. So what did I do? As I went and I started to do some research on GHK copper peptide. And I have the article right here in front of me from the International Journal of Molecular Sciences, because the other issue that I was diagnosed with hemochromatosis. And for those of you that don't know what hemochromatosis is, it's where your body is not utilizing your iron sufficiently, which can cause major issues, because if it's not being utilized properly, it'll store in your liver, kidney, lung, heart. So you have to get that under control. And how they found out is my ferritin level was in the 900 to 1,000 range. And it's supposed to be down around 200-300. And so again, for mainstream medicine, the only thing they can do is phlebotomy to get the ferritin level down to normal. So with the PMR, the only thing was prednisone. For the hemochromatosis, the only thing was phlebotomy. So I went and I had one phlebotomy, and then that's when I started to patch. And when I started to patch, of course, I had to go every 3 months to the doctor, and I had to go every month to have the phlebotomy. But when I went back for my second phlebotomy, they looked at my numbers and they said, wait a second, I don't think we need to do. So they went to the doctor and asked the doctor, and the doctor said, no, it's back to normal. And of course, everybody in the office was scratching their head. How did it go back to normal with just one phlebotomy? And very interesting. Of course, blood work doesn't lie. And then when I looked at this article and I read this article, and it says reduction of iron release from ferritin by 87%. So it was like a confirmation. And of course, when I did the blood work and my ferritin levels are back to normal, of course, blood work doesn't lie. And the doctors were all scratching their heads. So the last appointment I had with my hematologist, I said to her, because she looked at my blood work and she says, it's fantastic. What are you doing? And I told her, well, first of all, for my PMR, I'm down to 2 milligrams of prednisone, down from 15. And she said, well, that's great, but your ferritin level is back to normal. And I said, have you ever heard of stem cells? She said, of course. I said, have you ever heard of a stem cell activation patch? And she said, no. And I said, well, I am attributing a lot of that to this patch. And her response back to me was, keep doing what you're doing because your blood work is perfect. And us doctors, we don't know everything. So you can only guess the next time I talk to her and see her, we're going to have a longer discussion about the stem cell patch for sure. But it's had a pretty dramatic effect medically in me with both the hemochromatosis and the PMR. And my wife was having a lot of difficulty sleeping for the past 2 years. And ever since she's on the X39, she's sleeping like a baby. And there are so many testimonials. Another friend of mine that I introduced it to, and I don't know if she's on the call, but her husband said that she had scoliosis real bad. She went to her chiropractor after being on the patch for 2 months, and the chiropractor said to her, "Wow, your improvement is unbelievable." And then she shared with me that she's had Crohn's disease for 30 years. 30 years, been on every medicine she can imagine. And now she said to me the other day, she said, "My gut is perfect." She said, "I think my Crohn's is gone." So it just goes on and on. I could probably share more, but what the patch is doing is pretty remarkable for sure.
Absolutely. And I know you gave your testimonial about 8 weeks ago, so we love doing these updates. So now you've had 2 lab reports since you've been on the
Right.
X39, and the last one was better than the first one, correct?
Correct. Yes.
Okay. And I
Yep.
know you had pain with your PMR, and what was it on a scale of 1 to 10 prior to starting the X39, your pain level?
I would say, of course, the prednisone was sort of helping that pain level.
Right.
But whenever I started to titrate down, the pain started to come back prior to the patch. But I would say before, without anything, it was probably in the 7, 8 range, 9.
Mhm.
But now with the patch, 1 or 2,
Wow.
So it definitely has had a major impact in that area also.
Well, I know you also play golf, and we've heard a lot of stories with the X39 and athletes and playing golf. So I know you're able to play that more often now.
Yeah, before, I mean, I couldn't even grip a club.
Mm.
And the other thing is energy level. At 74 years old, I have all the energy that you can imagine.
Mhm.
So that is working well also. So anybody's on the patch. As a matter of fact, that young lady that had the Crohn's, her husband is in the construction business, and she said he's always tired. So she said I slapped a patch on him, and he's got more energy. He knows what to do with now. So it's great. It's great. Well, one other thing that I started about 2 weeks ago, not only the X39, which I'm putting here, the carnosine that
Mhm.
I'm, because I want to bring down a little bit more inflammation. Everything, all these issues are all based on inflammation. And
Yes.
so if we can get that
Yes.
inflammation down and under control, as evidenced by the fact that I don't have to take the prednisone anymore,